Hi, I'm Dr. Shruthi Reddy. I'm a consultant hepatobiliary and liver transplant surgeon associated with Sagar Hospitals and integrated liver care. Today I've been asked to talk about fatty liver disease. Fatty liver disease is on the rise in India. Now every 1 in 4 Indians are getting affected by fatty liver disease. What is fatty liver disease? The normal liver does not contain any fat. When the fat content of the liver increases more than 5%, it's called as fatty liver disease. What are the causes of fatty liver disease? So alcohol is one of the commonest causes of fatty liver disease. It's called as alcohol-related liver disease. But other than that, there are also other conditions which cause fatty liver disease, and this is called as non-alcoholic fatty liver disease. It's an umbrella term used for other causes. Now, what are these other causes? So basically, this non-alcoholic fatty liver disease, also known as metabolic dysfunction associated fatty liver disease, MAFLD, has been linked to metabolic syndrome. And what happens in metabolic syndrome is liver cells become resistant to insulin. So this insulin resistance causes fatty liver disease. Where is it seen? It's seen in conditions like diabetes, central obesity, high cholesterol levels, and in some familial conditions or genetic syndromes. So why should we bother about fatty liver disease? So early stages of fatty liver disease is itself not harmful, but with increasing severity and over time, this fatty liver disease will progress to something called as steatohepatitis, NASH. And this condition is where the fatty liver is getting damaged and the liver cells, the normal liver cells, are dying. When this happens, this is the stage which precedes something that can progress into liver failure. Now, every 1 in 4 patients with a fatty liver disease have some form of NASH happening in their liver, and a section of these NASH cases progress to cirrhosis or liver failure, and in this cirrhotic liver, even liver cancers can happen, which is why we should take care and prevent this condition as early as possible. So what are the symptoms of fatty liver disease? Most of the times fatty liver disease is diagnosed incidentally on ultrasound or other blood investigations. So sometimes it can also cause pain in the right upper abdomen because of the enlarged liver. How do we diagnose fatty liver disease? Now ultrasound is a simple and good enough investigation to diagnose fatty liver. A blood test that we call as liver function test that draws around 2 cc of your blood will be able to give you the manifestation of fatty liver. Whether this fatty liver is causing damage to the liver can be diagnosed on this. How do we treat this fatty liver disease? So typically we say healthy lifestyle avoids fatty liver disease, or it can even reverse early stages of fatty liver disease. So what is healthy lifestyle? It's again healthy diet, regular exercise, and avoidance of alcohol. So when we say healthy diet, we should restrict calories, not exceed the recommended calories for our age and sex, and we should also decrease the refined carbohydrates and saturated fats that we consume. We should resort to fruits, consumption of lots of fruits, vegetables, complex carbohydrates, and whole foods, whole grains. Now, if you ask which form of cuisine is better, generally advised is Mediterranean diet. People who consume Mediterranean diet have the least incidence of fatty liver disease. This is again lots of fruits, vegetables, and fish, and also olive oil based cooking. But if we have to use it in India, I would rather say reverting to our native foods, that is what we used to consume, what our previous generation used to consume in each part of India, is probably a better way, because they invariably contain whole grains, have less of refined carbohydrates, less of fats, and they are also much more healthier than the current junk food that most of us consume. What is regular exercise? Regular exercise is any form of moderate exercise for at least 30 minutes a day for at least 5 days a week. And again, what is avoidance of alcohol and other toxic agents to the body. So alcohol, we should try and avoid it completely. For those who do consume alcohol, you should not consume it on a daily basis. You should not exceed the advised dose. And again, you should know when to seek help when you're having some form of addiction which is developing. So you should seek help and you should be open about a possible alcohol dependence syndrome, and that way you'll be able to reverse the damage which is causing it to the liver as well. Other than alcohol, there are also some other drugs and toxic agents. One of the commonest things what I would like to point out here is these days most of the gym goers use a lot of supplements, and protein supplements are okay, but then these tablets and injections which some of them consume contain something called as anabolic steroids, and these steroids have damaging effects not just to the liver but also to the heart. So these things should be avoided. Other than this, this is for the early stages of fatty liver, for reversal or for prevention of it. For the next stage, that is the stage where the damage of the liver has already started, that is where we advise tablets, medications which have come recently into the market. They can be used. Again, your treating physician will be able to advise you on its usage. When it comes to the last stage, which is when liver failure or cirrhosis has set in, that is where a surgeon will come into picture. That is where, or sometimes when a liver cancer has occurred in the damaged liver, that's where you might have to have some form of surgical therapy for the cancer, or in case of liver failure, you might need surgery which is called as liver transplantation. Again, these are very few, far and few cases, thankfully, but then if the stage does need the intervention in a form of surgery or transplantation, then it would be a point of no return. So if you've been diagnosed with fatty liver disease or in any stage, be it early or a later stage, it's always good to seek medical attention. Early stages of fatty liver disease can be diagnosed and treated by primary physicians, whereas if your liver is getting damaged, it's always good to come to a specialist hepatologist or a hepatobiliary surgeon, and we'll be able to offer you the best treatment.